everybody, this is Dr. Radhika Meka from Parampara Fertility and Gynec Center. Today I'll be talking to you about how to plan your delivery. Most of the women are quite anxious and stressed when their expected delivery date is nearing. So how do we decrease the stress and anxiety? Your doctor would have given you your expected delivery date. A normal gestation period is about 40 weeks. So you would expect to deliver sometime from 38 weeks to 41 weeks. So how do we plan your delivery? First thing, you should know your obstetrician very well. See the same obstetrician during your pregnancy. Go for regular antenatal checkups. Clear all your doubts and queries before your expected delivery date. Do regular scans and blood tests. Have a friendly rapport with your obstetrician. So this will help you to relieve your stress. Trust your obstetrician. So your mental stress comes down very much lot. Second, go for some antenatal classes. They would teach you a lot of breathing exercises. When you have contractions, how to keep calm. Postures, when we ask you to push, what do you feel, how to push, all these would be taught. Light exercises in pregnancy also would be taught. So both knowing your obstetrician and your antenatal classes would relieve lot of stress from you. Second, when the expected delivery date is nearing, beforehand prepare your bag. Put in your hospital records, all your blood tests, all your scans, all your important documents into the bag. Also pack essentials for you and the baby. When the delivery date is nearing, you could have false labor pains, what we call as the Braxton Hicks contractions. This is normal. You shouldn't panic regarding this. These are contractions which you have for a few seconds and then it will gradually die down. Second, you should keep a track on your fetal movements. Fetal movements, roughly about 10 movements in 12 hours is normal. If you're not able to feel the baby moving, get up, walk, eat, have a shower, listen to music, the baby will get up. Even after all this, if you're not able to feel the baby's movements, then you should call your doctor. As the date is nearing, you could have true contractions, which are pains which starts from the back and radiates down below to the lower abdomen. Initially, it might be for a few seconds, but gradually it increases in intensity and the frequency. Apart from this, sometimes you would have a bit of spotting or fresh bleeding. Other times you could have also leaking, that is your membranes would have ruptured, they could be leaking down below. So if you have any of these signs, you should call our emergency number and speak to our midwife. The midwife would assess and she would ask you to come into the hospital if needed. Once you come into the hospital, you would be received by the midwife. She would check all your vitals, your blood pressure, your pulse rate, your oxygen sats, and connect you to the CTG machine. The CTG machine would record the baby's heartbeat and the contractions. Then the doctor does a per abdomen examination, palpates the contractions, does a PV examination to see the dilatations, the presenting part, the head, how far it is, whether it's coming down, all this would be recorded. If you're in the early phase of labor, we would ask you to mobilize, walk around, have clear fluids, and we would assess you again after 4 hours. If the contractions are quite severe, we might assess you earlier. If any pain relief required, like an epidural, which you would have already spoken to your obstetrician regarding it, that would be given at that time. So as the labor is going well, your husband could also be with you, helping you, supporting you, giving a back massage if required. Once you're fully dilated and the head is down in the perineum, we give a small incision, an episiotomy, what we call under local anesthesia. This is to increase the perineum for the baby to come in smoothly. Once the baby is delivered, the baby is handed over to the pediatrician and he would take care of the baby. We would stitch back the episiotomy, clean you up and shift you back to your room. After which you could have something to eat and then you're ready for breastfeeding. So this is what happens in a smooth normal delivery. So I hope I have given a gist of it. In case any further queries, any doubts in any step of treatment, you could put it down. I'll be very much glad to answer your questions. Thank you.